everyone. Thanks so much for having me today. And thank you to Zoe for inviting me and for the wonderful introduction. So I think many of us who are in attendance today care very deeply about medical misinformation and the role that it can play on the health and well-being of the American public. So I'd really love for this to be the central topic of my session today. Because we have very limited time together, I'm going to be focusing my 10-minute talk on a single, very high-profile misinformation event that my team investigated early during the COVID-19 pandemic, one that's especially relevant this year as we approach yet another contentious presidential election here in the US. And that event is President Trump's April 23rd, 2020 remarks regarding the off-label use of disinfectants as a COVID-19 therapeutic. So I'm sure many of us remember this event all too well, maybe better than we wish that we did. But for those who might need a refresher, let me read President Trump's remarks for you now, verbatim. Quote, "I see the disinfectant where it knocks it out in a minute, 1 minute. And is there a way we can do something like that? By injection inside or almost a cleaning? Because you see it gets in the lungs and it does a tremendous number on the lungs. So it would be interesting to check that so that you're going to have to use medical doctors with. But it sounds interesting to me." Needless to say, this event, which was widely televised during a White House press briefing, provided a really unique opportunity for my team to examine the repercussions of a highly publicized medical misinformation event on the health-seeking behaviors of the American public. In particular, my lab was interested in answering 3 specific research questions pertaining to the event. First, how did President Trump's remarks impact the behavior of the American public with respect to interest in purchasing, injecting, or drinking disinfectants? Second, how long did the impact of his remarks last? And finally, was this misinformation event associated with population level increases in adverse health effects like poisonings? There was a wealth of fascinating findings that we discovered through this investigation, so I'm going to keep my discussion of the methods brief and focus primarily on the results. That said, all the nitty-gritty details are reported in the paper that's cited at the bottom of this slide, and it's free to read at the Lancet Digital Health. So please don't hesitate to take a look if you're interested. Now, because my lab specializes in applying AI and ML for infectious disease surveillance, like Zoe so kindly mentioned, we opted to use novel digital data sources like search query and news media data to address our 3 research questions. To kick things off, we first collected internet search query data from Google to get a handle on what kinds of disinfectants the American public was searching for both before and immediately after April 23rd, 2020. Google search query data are fractional and relative. In other words, when interest in a term reaches a peak for a given time period, this means that the term was most popular at that point in time, and whichever term in a series of terms was most popular among them peaks at 100. Here, we can see that Lysol was the most popular term among the 9 disinfectants that we considered, and that it peaked around April 23rd, 2020. Other popular disinfectants included bleach and Clorox, with the remainder falling back from the pack. Now, with our initial search query analysis under our belts, we curated a set of search terms to represent 4 topics of interest: purchasing, drinking, and injecting disinfectants, as well as poison control, a proxy indicator for possible poisonings following the off-label consumption of disinfectants. As is clear from the search terms considered here, we chose to focus on the 3 most popular disinfectants that appeared to peak around April 23rd, 2020: Lysol, bleach, and Clorox. We pulled data from Google search trends for these search terms. We also pulled news media data pertaining to these topics so that we could implement a debiasing procedure to separate interest in President Trump's remarks due to media-generated interest from true interest in the off-label use of disinfectants. Debiasing was uniquely important in this investigation, given how rapidly interest in these remarks proliferated across information networks, especially news media networks, given that the misinformation event itself occurred at a press briefing. The autoregressive machine learning procedure designed to debias the search query data of media-generated interest is detailed at length in the supplementary materials that accompany this paper for those who might be interested. And it's one of the more interesting methodological contributions that I think my team was able to make in this space, especially early on in the pandemic. Now, prior to debiasing the search query data of media-generated interest, we plotted our raw search query data, and the results, which are shown here, were absolutely stunning. The action-oriented searches that reflected off-label use of disinfectants, namely drinking and injecting disinfectants, peaked immediately following Trump's remarks. And then, rather damningly, interest in poison control peaked the very next day. Results that are consistent with poisoning reports that were subsequently noted by the American Association of Poison Control Centers. Moreover, interest in these topics remained increased for an entire week following the misinformation event, suggesting that while most of the associated impact on population level behaviors likely occurred after the event itself, in the days after, maybe 24 to 48 hours, the impact didn't dissipate immediately, potentially due to network effects that allowed news coverage of the misinformation event to continue propagating. Now, debiasing to minimize the news media generated interest in these topics marginally blunted results across the topics of interest, as is shown in these 4 charts. But the overarching trends described in the previous slide remained fairly consistent. Now, I have to say, we can't infer causation from this work, but the fact that internet search interest in poison control centers peaked after queries regarding off-label use of disinfectants suggests that search query data could be used as an early warning surveillance system for poison control centers in the future, a need that is unfortunately dire even now as false cures and prophylactics for COVID-19 continue to be propagated by those in positions of power. Which brings us to the policy recommendations that my team made following this study. First and foremost, science communication at multiple scales will be necessary to combat sources of misinformation, including, unfortunately, political power players. Second, a surveillance system for public health misinformation should be established using novel digital data sources that allow us to monitor population-level behaviors following misinformation events like this one. By designing this kind of system specifically for healthcare and safety service providers, decision-making tools like the early warning system for poison control centers that I just mentioned can actually be effectively brought to fruition. With an eye towards establishing a surveillance system for public health misinformation, my lab is currently pursuing a geographic analysis to accompany the temporal analysis that I presented today to uncover spatial heterogeneities and population-level behaviors. And thus, what we like to say is vulnerability to misinformation, especially following high-profile misinformation events, as well as sociodemographic risk factors that accompany this kind of vulnerability to enable things like hotspot prediction of adverse health effects in response to high-profile misinformation events. We're also working on incorporating additional data streams like Reddit and TikTok to glean deeper insights into behavioral impacts following other misinformation events, such as the black market purchasing of falsely purported pharmaceutical therapeutics and more recently, fake vaccines. And on that note, thank you all so much for listening. I think I am at my 10 minutes, so why don't we open the floor for discussion? Thank you all again.